at this time. Good morning, everyone. Thank you for attending Smart Start's virtual conference. While we're not able to host the Smart Start conference in person this year, we're thankful we have the opportunity to share this content virtually with you. Before the presentation begins, we ask that you mute your microphone to ensure the workshop speaker is easily heard. And also, at this time, I would like to introduce to you Ms. Jacqueline Simmons and her assistants with her, and they will introduce themselves for today's virtual conference on presentation on what is child care, health consultation, and why it's important. Thank you and enjoy this session.
Greetings, everybody. Good morning. It's still morning, I think. I'm going to share my screen. And then I'm going to put on presentation mode. And I'm going to ask my colleagues here, you see the presentation in the right mode?
Yes.
Yes.
Great. I feel like I'm still, after a year of this life in Zoom, I'm still getting used to making sure it's done right. But welcome, everybody. My name is Jackie Simmons, and I am the project director for the North Carolina Child Care Health and Safety Resource Center. And I appreciate you all joining me via Zoom because I know how hard it is to be on a conference on Zoom. It's tough, but we're hoping that you enjoy yourselves with us today in the next hour or so, and you get to learn a little bit about child care health consultation in North Carolina. I am joined by my colleagues, Theresa Stenersen and Amy Petersen. And before we get started, I will let them introduce themselves so you know who you're gonna hear from today. Theresa, you wanna start us off?
Sure. My name is Theresa Stenersen. We're going to talk about what my role is at the Resource Center, but I'm a child care health consultant, I'm a nurse, and I'm a coach. And we'll talk about what those things mean.
Hi, everybody. It's nice to be with you today. I am also a child care health consultant. I'm a nurse and I'm a coach, and we'll talk more about my role as we go along later on in the presentation. It's really great to be with you today, and I hope you're having a good week so far.
All right, so we're going to start off asking you guys some questions because we want to know about you a little bit, or we're going to get to know you in a second. We want to ask you what you know about child care health consultation before, and health and safety in child care before we get started. So I put a question up here, and the question is, what health and safety supports do you think that early educators need? And what I'm going to do here is I'm going to put up a whiteboard. And you should be able to write on this whiteboard. What you can do is on the top right. Theresa, will you help me with the instruction because it looks a little different as the provider. You need to put annotate.
Yeah, click on view options and then annotate, and you'll be able to use the text button to write.
And so what do you think? So if everyone can use that text button and just write a little bit about what do you think children, the health and safety needs are for children in childcare, in your opinion. And if you can just try to write not on top of other folks if you can. So just move your little cursor somewhere else. And I know it's going to fill up. I'm hoping it fills up. I'm going to give it a minute for you guys to, or maybe two. Let's do 2 minutes. Okay, I'm going to try to
Oh, I love this. I see some familiar names coming up.
All right, I'm gonna start reading some of these out. Nutrition needs, any health issues or concerns within the classroom, sanitation, COVID protocols. I think that's a big one these days. Obesity reduction. I love that because that's a little, I don't know. It's not something what CCHCs are always known for, but it's a great one. Prevent injuries, absolutely. COVID again. Strategies for implementation of sanitation practices, absolutely. Nutrition, sanitation, technical assistance, absolutely. Diapering procedures, we have a reputation for hand washing and diapering, so absolutely. Common illnesses, updates, I love that. Health and safety practices, giving medication, absolutely. Sanitation, food safety, special healthcare needs, and infectious disease prevention.
I see mental health and social and emotional health there as well.
Awesome, awesome. Proper diapering, common illnesses, how to handle them, chronic disease. I love that because I think a lot of times we do talk about infectious disease, but chronic disease is absolutely a great one as well. Fun alternatives for inclusion. That just makes my heart happy to hear, that's really a big part about CCHC is inclusion, and we'll talk about that too. Incident report completion. Theresa, does that make you happy?
Yeah.
Handling injuries. Absolutely. That's a great one too.
I don't want people to get injured though. So.
No, but you do want to make sure that that folks know what to do when they are injured. And I know that all of my colleagues, Amy and Theresa, have spent a lot of time making sure that that we are teaching folks how to handle injuries and do things right so that that everybody is protected. So it looks like I think that I'm gonna cut it off now, but community support, that is super awesome. Again, that makes me really happy to think it's not just about that childcare environment, but it is more than that. It's bigger. It's the community. So great. So thank you. I'm going to save this because I think it's really neat, and I'm going to save that, and I'm going to hopefully be able to come back to that and share that with my staff, because I think that that's a really going to be an inspiring way for them to think about, how we're communicating what CCHCs do in the field. So that being said, I've saved it. I'm going to clear it. Clear all, and I'm going to ask one more question, and that question is, what services are you aware of that CCHCs provide? So let's go back to, can I do it? Go back to the whiteboard. And so what services do you know that CCHCs provide? If you can put that on there now, we'll fill it up again. We'll give a few minutes. There we go. Here it comes. I feel like this is what happened last time. All popped up at once.
It's okay not to know. That's what we're here for. That's
Yeah, it's okay, absolutely okay not to know. And I love that. Not sure that's why I came to the session. Well, great. We wanted to know where to start. This is kind of for us as much as it is for you. So appreciate what you know and what you don't know. I'm going to give it one more minute, and then I'm gonna keep going. All right, so I'm gonna health and safety trainings, medication administration, technical assistance, trainings for safety, trainings on health and safety, trainings, yes, coaching, I love it. Health and safety trainings, interested to learn. I love that you're saying that too. Sanitizing, great, all good stuff, all awesome stuff. So this helps us because, I think that what's helpful for this is that, the first question we asked you, what things facilities need, and this question we asked you what CCHCs do, and it's interesting that they don't align. So I think that's food for thought on our end, and it's also helps as we go into this this session and talk about the breadth of what a CCHC can and does offer. So thank you again. I'm going to save this one, and I'm going to go back to the slides. And what I'm going to do is I'm going to talk through a few scenarios to get to know about when a CCHC is going to be helpful in different types of situations. And I'm going to ask Amy and Theresa to jump in at any point and help me out here. I will be completely frank. I'm the program director of the Resource Center. I'm I've never been out in the world working as a CCHC. I have been at this kind of administrative level for a very, very long time in public health, and I rely on my incredibly talented staff and for their experiences out in the world and the CCHCs that are out in the world. And so, I'm going to talk about when you call a CCHC, because I know it probably as well as anyone in writing, but out in the world is where I really rely on my colleagues, Amy especially, who spent many years as a CCHC in Wake County. So here we go. A child with a severe peanut allergy has enrolled and needs an EpiPen. Yes?
We're still seeing the whiteboard.
Oh no, you're seeing the whiteboard. Okay, let's go back to the... Let's go back to... Now do you see?
There we go.
Is it good? Okay, okay. There's always a learning curve with this. Okay, so this is our first scenario. A child with a severe peanut allergy has enrolled and needs an EpiPen, but staff don't know how to use one. Well, that is a great time to call a CCHC. The reason this is a really important question is because the question comes in about one child. But what a child care health consultant really is focusing, and really what our mission is at the Resource Center in general, is to focus on the environment of the child care facility. So we get that call about one child, and that child that enters the facility, and the staff who's nervous about not knowing how to administer an EpiPen. If the child does experience an allergic reaction, anaphylaxis, but what is an opportunity for that child care health consultant to go in and say, okay, but any day a child could walk into a facility with an allergy. And so the staff need to be trained. It's not just about that one child, it's about any child that may have anaphylaxis. I read at some point 3 out of 5 children who experience anaphylaxis do so with an undiagnosed allergic reaction. So, this is the 0 to 5 is the time in life when we're figuring out if kids have allergies. So something could happen with, without a child being, even diagnosed or known. So that's why it's important for it. While that child is incredibly important, it's also important for the, for the facility to be able to provide that, emergency response to a child who is having, a medical event. So the CCHC can help by reviewing the medical action plan of that child and also providing training on medication administration to, everyone in that classroom, the whole staff possibly, on allergies, anaphylaxis, and emergency treatment with epinephrine, which is the medicine in the EpiPen. Amy, Theresa, what did I miss? Anything you want to add to that? All right, we can go on to the next scenario. A toddler has a rash that appeared during the day. The child is itching and complaining about it. So I don't know about you all, but I had 2 children that went fully through childcare, from 6 weeks to kindergarten, and rashes happen. And you never know what it is, anything from, they just came up against something that their skin didn't like that day, or chickenpox, something. And so you get that call. And again, this scenario, I think, gets back to the, that child may have a rash, and it may be something unique to that child. So that child probably should see a healthcare provider, their doctor, their physician, or to make sure that it's not something that is contagious. But the bigger thing that a child care health consultant can then do is, if all of a sudden we realize that it is something that's contagious, and maybe that all of a sudden the providers realizing that there are children in the classroom that also have this rash, the CCHC can help determine whether all these children need to be excluded, understand if one child is diagnosed, what the implication will be for the other children in the classroom, in the school, and provide guidance on the spread of any kind of infectious disease, or this particular infectious disease, and how to prevent that and prevent the ongoing spread of that in the classroom. I mean, does there need to be cleaning? Do all the children need to be sent home to have treatment of some sort? Maybe it's a rash related to something where everyone needs to be treated. Scabies is one that comes to mind, where everyone should be treated before they're returning to childcare, and that happens. So a great time to call a CCHC to help kind of handle that at the level of the facility. All right, we're gonna
I'll just add
please.
that first bullet there, that
Mhm.
I mean, CCHCs are not able to look at and diagnose infections. I'll just
Right.
point that out. And I think that is one of the areas where CCHC, well, nurses can't make diagnoses for anything. But there's a CCHCs, and sort of school nurses are a different role. And where in school, a nurse might come and take a look at that rash and say, oh, do this, do that. CCHCs are really not able to make that determination at the child level. So anytime there's a suspicion of a contagious illness, just reiterating that the child will seek a healthcare professional to get that diagnosed.
All right, we got 3 more scenarios to talk through. I feel like these are fun. I hope they're fun. You can tell us in the evaluation if they are or not. But this one is about a 9-month-old infant requiring a feeding tube. That's a pretty complicated issue. And they must sit still for an hour for a full feeding. So that's a long time for a 9-month-old to sit still. So the staff's really worried about making sure this child is being fed correctly, which is kind of more of the medical concern. But they're also worried about that child being stimulated during that feeding. So they're not sitting there staring at a wall for a whole hour. That's a long time for, as I said, for a 9-month-old to be sitting still. So what do we do about that? Well, a CCHC can really provide good guidance and safe practices on tube feeding. And that's something that I know that we are actually actively working on, making sure that there's good training out there on feeding tubes. But this is also a really great opportunity for a CCHC to partner with another TA provider in the community, an infant toddler specialist. Seems like it would make sense in this situation with a 9-month-old to start thinking about what are creative ways that this child can be stimulated during that hour feeding, so that they, that it becomes kind of a team approach to how to serve that child and make sure that they're having the best experience they can, while being in childcare, and so that they can be in childcare safely and and have kind of that. We're going to talk a little bit later about having all of the services needed and how those services can work together. So that's a really great example of how TA providers should work together to serve that child's needs. Okay, here's one. A child cut her head on the playground equipment and blood is everywhere. Blood is a scary one. I think that is a tough one. First of all, it's a tough one to, the initial reaction can be scary, and then the cleanup of the blood itself can be a scary situation. It's a great time to call a CCHC. But first phone call should be made is probably 911 if it's, obviously if it's a situation that requires, more serious medical attention. And then the child's parents, of course. But second, call CCHC, because what the CCHC can do is 2 big things, I think, is one is help with the safe handling of blood and incident documentation. So handling of blood is a pretty complicated endeavor. And I know Theresa spent a lot of time on bloodborne pathogens and how to address the cleanup and handling of materials that have helped clean up blood or other things that might have bloodborne pathogens in them. And so that becomes something that really takes the expertise of someone who has gone through the training. So CCHC can absolutely do that, help document the incident. And then they can also help go out and look at that playground. What was it? Is there something that really needs to be changed about that playground? Because that sounds pretty serious. children should not be around equipment that has things that can gash them or cut them. Last one, a facility realizes they do not have a policy that addresses when to exclude children from childcare due to illness and does not know where to start. Well, exclusion criteria is probably, maybe after hand washing and diapering, one of the biggest things we get calls about, because it is always really, really hard. I'm sure everyone knows. It's really hard to send a child home, especially without good information for a parent, because parents, being on the receiving end as a parent, you never want that phone call that you have to leave work and go pick up your child, because that's always tough, especially when you don't feel informed to give the right answer. So we have on our website a whole list of exclusion criteria. We follow the American Academy of Pediatrics, and we kind of couple that up with the North Carolina child care rules and make sure that CCHCs have the best information so that they can give the advice about when exclusion really is necessary, who it's necessary for. And I think that probably everybody who's been anything related to childcare in the last year knows that exclusion criteria is pretty complicated when it comes to things like pandemics. And so I know that my staff and all the CCHCs have been working, around the clock, making sure that the childcare facilities have the right information on exclusion. And, words that we didn't know this time, a year and a half ago, quarantine and, all of those complicated issues. And then also working with the local health departments and other partners to make sure that those decisions are made in concert with the folks that make those decisions. So always working together and always working from expert sources, and that's kind of how CCHCs work. So those are some scenarios. I hope that was illuminating in terms of just understanding kind of the breadth of some of the things a CCHC does. So now let's take a step back and say, who are child care health consultants? Well, all child care health consultants are trained health professionals with education and experience in child and community health and early care and education. We know that because we at the Resource Center train them. Everyone who considers themselves a qualified CCHC in North Carolina has taken the North Carolina course, child care health consultant course, and has successfully completed that course to become a child care health consultant and have that title. So we are, we have, oh gosh, depending on the day, about 45 child care health consultants across North Carolina. And I think that I've talked a little bit about this last bullet at the bottom, that they work with child care facilities, CCHCs do, to assess, plan, implement, and evaluate strategies to achieve high quality, safe, healthy childcare environments. So we've talked a little bit about that, I do always, I think I said it earlier, but I always like to focus on that word environment. I know we talked about that with the child with the EpiPen, that it's not just about the one child, but we really like to look at the classroom environment. We like to look at the facility level environment so that we are providing, always providing technical assistance and support at that facility level so that everybody in the facility is able to serve children the best way possible. So we have a service model that the CCHCs work under, which is really was a way of standardizing the practice of child care health consultation across the state, so that one child care health consultant looks like another child care health consultant and provides the same level of service and the same type of services. We also work under a set of competencies. I think that we put those competencies in the pre-rating for this, but if you didn't get a chance to look at those, I welcome you to look at those competencies after this session. There are, goodness, I'm gonna blank now, how many, 17 competencies, Theresa, Amy? And what it does is it just outlines all of the areas that a CCHC can provide guidance and support in those competency areas. And those, I think the important thing is, as you can see here from this very little picture, is that these are not set by North Carolina. These are not set by me. These aren't set by the Resource Center. These are set by the Office of Child Care. at the federal level, so that other states across the US are also using these competencies to define what childcare health consultation means to them as well. And then, of course, we use caring for our children. If you don't know caring for our children in the childcare world, I suggest taking a look. It gives us all of our guidance. We kind of call it our gold standard for everything that we, all the services that we offer and the guidance that we provide.
Jackie,
Yes.
I was going to say, Yvonne put into the chat early on a link to that document about the competencies, the at a glance version.
Great. Awesome. Awesome. And in that, there's an at a glance version. I think it's 2 pages. And then there's a longer version, which if you click in the at a glance, it'll give you the link to the longer version if you really want to get into what a CCHC does. That's a really good way to do it. So I talked about our competencies. I don't need to go into it again, but this is a nice picture of a CCHC. I think this is one of our colleagues out in Colorado, actually. And again, our competencies, I keep coming back to it because this is really important because it really is the foundation for what a CCHC does. And these competencies actually came out, I think, 2 or 3 years ago. And so we've really adjusted a lot of our work to make sure that we are, that our course follows these competencies and our guidance follows these competencies. And so that we're always coming back to this list and making sure that what we're doing, that we are meeting what is set up by this national standard at all times. Okay, so how do we implement them? So we do a lot of stuff to implement them. And what is all that? We assess, so childcare health consultants go into childcare facilities and they do observational assessments. And they do a cycle of assessments. So they do a pre-assessment and they come up with a quality improvement plan based on that pre-assessment. And then they do a post-assessment. And so there really is a very specific and in-depth look at a classroom when they do assessments. And that's a big part of what a CCHC can do and does do. And again, those assessments are all based on those competencies. How, each one of those competencies represents a different section of our assessment tool. CCHCs develop strategies, especially for inclusion of children with special healthcare needs, among other things. That's a big one. We support early educators in managing injury and infectious disease and chronic disease, but that kind of leads into those children with special healthcare needs. We connect early educators and families to community health resources, which is, CCHCs would not be successful without our community, without our other TA providers. So any TA providers on this call, I welcome you to connect with your CCHC and thank you for being here to connect with us. We provide up-to-date information on regulations and best practices. We try to keep as up-to-date as we possibly can. We have a post link on our homepage of our website. You can actually sign up to get our up-to-date information. We try not to overpost, but we try to put the most important things on that page. We deliver health and safety technical assistance and training. I think we're known for training, of course, but also providing in-facility technical assistance as well. And reviewing medical action plans, medical forms, immunization records. That is absolutely under the purview of a CCHC as well. All right. So this over here is a picture of the ingredients that go into what CCHCs kind of blend together a lot of different guidelines, laws, all of the things listed here to create the best possible guidance for a facility. So taking those state rules and laws and the federal laws, think federal laws, OSHA, take sanitation rules in North Carolina, which, as you all know, are separate from the childcare rules. Taking best practices, I mentioned caring for our children, and then whatever topic area we're talking about, there's always a group that we usually reach out to. We just had a meeting with the folks at the Epilepsy Foundation for seizure disorders, and so we're always trying to reach out to expert sources, making sure that we have the most up-to-date information that is out there. And then, of course, we can't forget the environment rating scales as well, because we know that that's always a question when we go to do assessments, is making sure that folks, are able to, keep and meet and raise their star ratings as well. Children with special health care needs. Again, I talked about this a bit earlier, but there's a lot of things that CCHC can do to support a child with a special health care need. Medical action and individualized healthcare plans is one thing. Medication administration, that's always a much needed request for CCHCs. Condition-specific training, so that's anything from diabetes, seizure disorders, anything that requires kind of more specific knowledge. Helping meet the Americans with Disabilities Act guidance, absolutely, and making accommodations for a child that might walk into the facility that needs an accommodation. 504 plans, individualized education plans, absolutely can be on the team to help make sure that those plans are implemented appropriately and can serve the child the best way possible. Can absolutely help with kindergarten readiness, especially for children with special health care or other medication or health needs. And also support individualized family service plans and early intervention services, making connections, referrals, identifying when there's need. That's all things that CCHC is part of what they do. Health and safety assessments. I talked a little bit about this earlier, that CCHCs do have a tool where they go in and do a cycle of assessment, going in and doing an observation, looking at, for example, looking at the hand washing and diapering procedures under the umbrella of infectious disease, and making sure that maybe, what can be done better? What are we trying to identify? It's not totally meant to be just what's going wrong, but it's meant to be a kind of an assessment of, what's good, what's not, what can be worked on, and then putting together that quality improvement plan to make sure that the facility is able to, increase their standards. Maybe it came from, why did we start an assessment? Maybe there was a norovirus outbreak and there's something in the facility or in that classroom where, the hand washing just isn't being done quite right, and that children are spreading an infectious disease. I mean, that's absolutely a scenario that has happened many times. And so that we can kind of come in and work with that classroom, that facility, and increasing, the best practices so that is avoided in the future. Nobody wants to send a whole classroom of children home for a week, and nobody wants to get sick. So, and then the final loop of that assessment process is obviously the follow-up assessment to make sure that efforts were implemented correctly and that we're learning and moving forward, always moving forward. And there's, as I said, there's an assessment section for every one of those competencies. So a CCHC can address any one of those that are listed on that list. All right, pandemic and emergency response. Oops, I jumped ahead. I think everyone knows what this little disease molecule is. This is COVID, of course, and COVID has been probably, I don't know, I hate to say 90% of our work in the last year, possibly. Maybe certain days it was 100% of our work. CCHCs and the Resource Center together, we really started in on the COVID conversation, I think it was March 16th, 2020. So that was the first day I remember being called in and saying, what are we going to do? How are we going to provide supports for the child care facilities in North Carolina to be able to handle this pandemic? And really the CCHCs took on this kind of call and try to figure out, how are we going to support child care facilities? And I just, I think I can't say, it's just the CCHCs, but as a state, it's just, I think it's pretty unbelievably remarkable that, child care facilities stayed open. I know it was hard, and it was hard on our end. And I know that the Resource Center staff and CCHCs worked around the clock at some points to try to provide guidance and support, but it pales in comparison to, I know, what the child care providers were doing out in the field and providing support throughout this incredibly scary and difficult time. But one of the things that the Resource Center did was continue to work with the state to keep that child care toolkit updated and make sure that it was appropriate for child care. And then make sure that the CCHCs were armed with the best document that we could create to go out in the world and provide the guidance to keep everybody as safe as possible. We learned a lot on the way. We had a lot of, it was a very challenging year, as it was for everybody, but really it really highlighted the need for and the role of the CCHC and being part of kind of the, the menu of things that a childcare facility really needs to operate safely and keep children safe. So Amy, Theresa, you want to add to that anything about COVID specific?
Just to kind of add on to what you shared about it, the pandemic, while it was a really difficult time, it really highlighted the critical need for childcare programs to be open and to just really recognize that they are our most essential and precious workforce, that they're really part of our critical infrastructure of our state, and that families would not have been able to, those families who had to go back to work would not have been able to do that had childcare programs not been open. So we just really appreciate that.
Absolutely. Yeah. I mean, what a year, guys, huh? All right. So trainings, I feel like there's a few things that the Resource Center really is known for, and one of them is posters, and the other is trainings. This is just you don't have to, obviously there's too many words here to read all of them, but these are just some of the things that a CCHC can provide. Training and types of actual names of training, like at SIDS and emergency preparedness and response, and then topics of trainings, but there's really within those competencies, there's really no end to what a CCHC can provide in terms of health and safety. And if a topic comes up that we don't have a training on, we find one. We figure out what what needs to happen, if we need to add to our training library so that we are serving. So if there's ever a training that you need and you don't think is out there, let us know. We will respond in a way that hopefully is really helpful so we can get that good information out. All right, Theresa, this is you. Do we want to put up the poll question?
Yeah, I was just wondering if we wanted to pause for just a second and see if anybody had any questions, and feel free to put them in the chat. And I know Jackie has a poll before I get started.
I'm gonna launch the polling. Is that good, Theresa? Or do we?
Sure.
You guys can welcome to ask questions, answer the poll, take a breather. Let's give it a couple minutes.
And right now there aren't any questions in the chat, just a couple comments about partnering with the CCHC to join their weekly directors meetings.
I love it. That's awesome.
And how helpful that was to be able to have facilities safely stay open. And then one other person just shared a personal experience of injury on a playground with their child and how they felt like the program was not really prepared to handle that well. And just shared her story. So we appreciate all that.
Goodness, that's too bad. I hope that they can learn to work with a child care health consultant. And there's nothing worse than getting that phone call as a parent sitting there and said, there's been an accident. It's the worst.
Are you going to show the results of the poll?
I will try. How about that, Theresa?
And I just
I'm going to give it another minute. I don't want to end the polling.
Oh, sure.
Let me give it
Yeah,
one
don't
minute.
end it till it's.
Mm-hmm.
And while we're doing that, I just want to share that I live in the very far west of North Carolina, in Macon County, and we got, just as Jackie was speaking, we got a lot of thunder and lightning starting, and I live very weak, so just please be prepared. If I suddenly disappear, it's probably because the power went out.
All right, I'm going to end the polling and let's see if I can share this. Do you see it?
Yeah.
Cool. That's neat. Although I'll be honest, I'm surprised we have so many others. So I got to know what these others are. Maybe if you're an other, would you mind putting that in the chat so we we can rethink about how we're putting this question next time we use it. So maybe we want to capture some other roles.
That'd be great.
I love that we do have a mix. I know it's not a hugely big numbers in some of the other areas, but I love that we have a good mix of folks. I think that's a great. I think that speaks to is how important it is to have this mix of folks talking about working together. All right, I'm going to stop sharing results and I'm going to go back to the slides. Okay, Theresa?
Sure.
Thank you to those who've put
I'm
some
watching.
things into the chat. We've got
Yeah, on here.
lots of various roles.
Amy, do you mind reading some out?
Yeah, we have some executive directors from partnerships. We have early intervention service coordinator, program director. We have child care director, a center director, parents as teachers, program coordinator, community alignment specialist, family resource and pre-K director, program operations managers, resource and referral specialists. We have a nurse home visitor with nurse family partnership, researcher. Yeah. So a parents as teachers, a parent educator, and I think that is a kindergarten readiness coordinator at Smart Start. And I think that kind of covers the different. A quality assurance specialist is another one I see. So, thank you all.
All right, Theresa, it's all yours.
Okay, and I think if I was watching the chat, but I think Jackie she clicked on the slide that slotted childcare health consultants into this group of folks. You all and people that you interact with, that you work with, people you may supervise, who are all surrounding childcare to provide support and help folks into a better quality childcare. So we know that there are consultants who work with the educational aspects of childcare, with mental health and social and emotional health is the word. Other folks that are providing technical assistance, regulatory agencies. Didn't see anybody from regulatory agencies here today, but then there's also project specialists, and we're going to go through some of how CCHCs work with these different groups. And what we want to see, what I think everybody wants to see, is that all of the folks who are wrapped around childcare facilities and teachers and directors, and I'm saying my internet connection is unstable, so I'm going to stop my own video for a moment, just so you know that's where I've gone. I'm still here. We want to see childcare facilities surrounded by a group of people who are on the same page, collaborating, making referrals to each other, and like the thing says, providing consistent message to early educators. So one of the questions, and I'd love to see some of the answers to this in chat, is how do these group of people connect with each other in your community, make referrals? How do they know each other well enough and have a warm fuzzy bubble of the other, so that everyone is in that warm fuzzy bubble to have childcare facilities really feel like they're being surrounded by a group of people that are all on the same page. And this is where we have seen with COVID, one of our colleagues had quoted Winston Churchill at the beginning of COVID, that he had said, never let a crisis go to waste. And we've seen, particularly well, with all sorts of folks, there have been a lot of people surrounding childcare facilities in a coordinated way regarding COVID, including health departments and the communicable disease folks there, the regulatory agencies, and other folks who are providing technical assistance. There's been a lot of directors meetings going on. There's been a lot of other meetings going on, TA referral meetings going on in North Carolina related to COVID, and we want to see that continue to build. I'm seeing meetings for various children groups, technical assistance calls monthly. That's great. That's great. Monthly is, I mean, that's awesome. So I know that a lot of folks have technical assistance meetings. I've heard, I think quarterly is what I used to hear. Maybe that has ramped up. Monthly is an awesome. It's great when they're housed together. That's absolutely true. So, okay. I think I know Libby. Hi, Libby. Jackie, if you want to go to the next slide, we'll continue to talk and look at those meetings, those ideas coming in. So the referral process for CCHCs, for other folks, I want those handoffs to happen so that when there are health and safety concerns, that childcare health consultants can be brought in, and where there are educational concerns or other concerns, that we bring in the education consultants. We're going to go through some of the different groups here in the next slides, just so we know each of the different type of people providing technical assistance and support to childcare have areas of expertise. And we have learned a new term with COVID, that there's a SME, a subject matter expert, and childcare health consultants really have that health and safety concerns is their subject matter that they're experts in. If you want to go next, Jackie, next.
I'm coming.
And click one more time just to get that list up.
There we go.
So there are special initiatives in North Carolina, of course, the infant toddler specialist, healthy social behavior specialist, school age specialist, inclusion specialist, family child care home specialist. And I'm seeing there was some other folks that were mentioned in the chat box there who have special initiatives, and we want to see specialists collaborating with CCHCs to provide ongoing support to childcare facilities. And then CCHCs, on the other hand, will then seek guidance on the area of specialty, because we do know that it's going to take a village for childcare facilities. And when, so let's take healthy social behavior. It was mentioned in that whiteboard at the beginning that childcare health consultants do and can work with childcare facilities on providing support for the environment to create healthy social and emotional, well, the environment. So childcare health consultants work with the environment to as do other, but mental health and social and behavioral health is an aspect of health, and childcare health consultants can seek guidance from the folks who are in these special initiatives to make simple changes, to make the changes that will help to the environment. It may just be that a transition is going horribly wrong, and then there's behaviors that follow, and then refer to the specialists as necessary, so that becomes a loop that is very collaborative. If you want to go to the next one. For regulatory agencies, I mentioned that particularly with COVID, we're seeing that the DCDE licensing consultants, childcare health consultants, have been referring to CCHCs for health and safety concerns and guidance around the COVID toolkit in North Carolina for childcare. And that happened also before COVID, with supervision issues or sanitation issues that are seen by the different regulatory agencies. They can refer to CCHCs to provide health and safety training and technical assistance based really on those childcare sanitation rules. CCHCs have a good background in. So that if we want to see even more of that going forward, now that we've got a basis of that because of COVID, I think we can build on that and continue to grow that referral system. Next. The health departments. So children in childcare, we have a quote that one of our childcare health consultants that had worked in this role for a very long time would always say, children in childcare are a public health population. And CCHCs are really working to promote public health in childcare. And they're going to work with the health department for outbreaks of communicable disease, COVID, for example, Shigella, pertussis, a lot of, when there's outbreaks of communicable disease, CCHCs can be that contact point between the health department, the communicable disease folks there, the epidemiology team can refer issues and work with CCHCs to get information out, for CCHCs to do observation, what's going wrong when there's an illness that is known to be spread through the fecal oral routes. We can go out and look at the diapering practices, and then also the food safety practices, right? So those things are connected. We want to see that continue. And I think in the counties, the CCHCs and the communicable disease nurses have really made a strong connection during COVID, even in counties that previously didn't have a CCHC. So we'll talk a little bit more about that in just a moment, I suppose. But if you'll go to the next slide, I'll introduce you to the coaches.
Hey, Theresa, I just want to add one thing for the health departments, that child care health consultants could be the health department could be a hiring agency for child care health consultants. So they may very well be housed in your local health department in that role. They also can work in a local partnership or like a community-based organization. I just wanted to point that out, that sometimes the CCHC is actually embedded in part of the health department staff.
Yes. And that works well with that connection, even when CCHCs are not embedded in the health department. It's important that they have that strong connection as well. So you've met Amy and I. There are two other coaches, Lisa Shiflett, who had a shout out there in the chat a few minutes ago, and Carla Cooper, who's Carla's covering the South Central area, and Lisa's covering the North Central area, where Amy is in the East and I'm in the West. Here's our contact information. If you are in one of these counties and want to talk more about CCHC, feel free to reach out to us and we can get you some information. And you'll see our email addresses are slightly different. Amy's going to talk about her role, but Lisa, Carla, and I are all employees of the Resource Center and work for Jackie, where Amy is an employee of the Division of Public Health and is part of the agreement that we have in our work with the Division of Public Health. She is also serving as the Eastern Region coach, and she'll talk more about herself in just a moment. Next. Jackie, next. slide, please. Okay, so we coaches provide support to child care health consultants, both before and during and after the CCHC course that the Resource Center administers that makes them qualified CCHCs. So we're providing support to CCHCs from the day they start, and sometimes before they start, throughout their career as a CCHC. We orient them to the world of childcare if they haven't really been in that world before. We guide them towards those CCHC competencies that were mentioned that are also in the handouts. We provide ongoing coaching. We train them on the use of the assessment tool. We have regular communication with the CCHC group as a whole through webinars, meetings, and then a lot of Zoom calls as well. If you want to go to the next one, Jackie, we'll talk a little bit more about how the coaches can and do also provide support to both funding and hiring agencies. So Amy just mentioned that CCHCs have different sources of funding in North Carolina, but primarily funding for CCHCs happens through local partnerships for children. Thank you all very much. And then the local partnership for children can either hire the CCHC, both fund and hire a CCHC in the through the office there, or have a different hiring agency, which typically Amy was mentioning is the health department of Carolina, but there are other models out there in North Carolina of where the CCHC has their direct supervisor. Provide support to both of those agencies out recruiting, hiring, supporting CCHCs. We want to provide support to the CCHC and their hiring agency and funding agencies to make sure that the fidelity to the CCHC service model is there. So we guide CCHCs to look, Jackie was mentioning this at the beginning, we want CCHC activities to be recognizable from community to community, have those core competencies that are mentioned in the CCHC competency document. And one of the times that we do want to see these agencies reaching out to the CCHC coach, particularly, is during planning for and in reporting contract deliverables. So we want to have those touch points so that CCHCs are supported and their hiring agencies and funding agencies are supported during those processes as well. Okay. Are there any questions about that? I'm not seeing any questions in chat, but if y'all have questions, please feel free to shout them out and we'll make sure to cover that. So in addition, so the coaching support CCHCs, the Resource Center as a whole there's more of us than are just the coaches and Jackie that work at the Resource Center, and we're promoting healthy and safe indoor and outdoor environments in early care and education through child care health consultation. So that's our mission. It's our mission statement, Jackie. I get confused between mission statement and vision. So that is what the Resource Center does. We've got, and we're going to talk more about, I think we're going to talk more about that in the next slide or two. So the things that the Resource Center do is provide training and technical assistance, guidance and expertise, advocacy and public awareness. And I'll just throw in a shout out there that it wasn't last week, the week before last was the week of the CCHC as proclaimed by Governor Cooper. And declared on the House floor. So that was a really awesome thing to see. We provide a lot of resources. Jackie, I'm getting a little bit confused between this meeting and the last meeting that we were on, but we have a lot of resources on our website and other places. The Resource Center's website is broad and deep. So take a look there. And then the majority, I would say the majority of our effort is providing support to CCHCs. Jackie, do you have anything to add there?
No, I think that's good. You know, I always say this, but a lot of folks know us for our hand washing and diapering posters, and they're all there too. So come visit our website and poke around. There's a ton of stuff on there. We spend a lot of time trying to make that really helpful and useful and up to date as much as we can.
Oh, it's group, yes. Nice.
Oh, there are the posters, of course.
There's the
You
posters,
recognize
and
them.
I have to, when I'm introducing myself to a group of childcare providers, I'm like, where the poster comes from? That seems to, those are ubiquitous. Is that the right word? Am I using that word correctly? In childcare facilities, over those sinks, we've got those hand washing posters. We've got news and posts on our website. And we have a Facebook page, we have a Twitter account. So follow us on social media. Visit the website. There's a place to sign up on the website to get emails when there is a new post. We've got communicable disease and exclusion charts on our website that's searchable. We've got fact sheets about common things. I know Jackie mentioned earlier, bloodborne pathogens, the requirements that OSHA and the North Carolina Department of Labor have for child care facilities to keep their employees safe when coming in contact with blood and other body fluids. So there's some information about that. Newsletters that are sent out, and typically DCDEE will send out the North Carolina Child Care Health and Safety Resource Center newsletter, e-newsletter. So hopefully you've seen that. You can also sign up for those. We have sample policies for facilities to use and provide support implementing those policies. And CCHCs do that. And then we have again with all the posters that are orderable. So there's a lot of stuff out there. All right. I'm thinking this is where Amy starts. Am I correct
Yes.
on that? Yeah.
So just continuing on, so we've talked a lot about the Resource Center and all of the resources that are available to child care health consultants. But just a reminder that, child care health consultants are hired at the local level. And so they are supervised and, are accountable to their hiring agency. But this slide just kind of talks about the support system that's in place from the statewide perspective for the CCHC network. So while they're hired at the local level, we really have a pretty rich support system in place. And that includes the North Carolina Division of Child Development and Early Education, the North Carolina Partnership for Children, Smart Start, the North Carolina Division of Public Health, which we've already mentioned a couple of times, the North Carolina Child Care Health and Safety Resource Center. And then we also have the North Carolina Child Care Health Consultant Association. And I'll talk about that a little bit later. And the goal of these really working together as a system planning and governance group, looking at child care health consultation across our state. Our vision is that we are going to have CCHC. Our goal really in our vision is that we would have CCHC coverage in every county and that every child care program in North Carolina would have access to a child care health consultant. And I think Jackie mentioned earlier, we have about 45 local child care health consultants, and we are in the process of an expansion of hiring new CCHCs across our state. So we are really excited about the opportunity to get some coverage in those counties that have not had one before. So if you'd like more information about that, please reach out to the Resource Center or the CCHC coach for your region, because we are adding new folks to our network every day, and we're very excited about that. But the collaboration around between all these different agencies really is looking at how do we support the role of the CCHC and ultimately provide healthy and safe learning environments for young children. You can go to the next slide. So at the Division of Public Health, I work in the Children and Youth branch that's inside the Division of Public Health, which is part of the Women and Children's Health section, and then that falls under the Department of Health and Human Services. It took me a while to get that really clear to be able to describe that. But I feel very fortunate to be able to be part of our public health system. And like Theresa said, part of my role at the Division of Public Health is to provide coaching support for CCHCs in the eastern region of the state. I collaborate really closely with the Resource Center staff and help contribute to the CCHC course, as well as the development of trainings and resources that are available to child care health consultants. And additionally, I'm able to provide some leadership in public health efforts at the state level that's just focused on early childhood education. And again, that public health population of young children that we want to make sure are that we're recognizing the needs of that group. Next slide. So at the Division of Public Health, I get to work very closely. If you see the circle in the middle, kind of highlights some programs in the Children and Youth branch that I work with very closely. So child health staff, so child health nurse consultants who are supporting local health departments. I think I'm getting mixed up with the other meeting we had this morning, but CMARC was formerly known as Care Coordination for Children. It's now Care Management for At-Risk Children. Triple P Parenting Program, Home Visiting Programs. We have McV and we have Family Nurse Partnership. And I know that we have a couple of nurses on the call that are Family Nurse Partnership staff. So we appreciate them being on this call. At the branch, we have the Children with Special Healthcare Needs Help. Families can call to get connected with resources in their community to support their child with special healthcare needs. School health, and we also have genetics and newborn screening that I work closely with. And then outside of our branch, there are other branches in the Division of Public Health, the Nutrition Services branch, which CCHCs are going to intersect with a lot of these programs as well, with the Child and Adult Care Food Program, WIC, and also breastfeeding support. We've also already mentioned in response to COVID-19, we've worked really closely with the Communicable Disease branch over the past year and 2 or 3 months to be able to support child care programs being open and being able to be open safely. The immunization branch, child care providers are required to fill out that annual child care immunization report. So we often work closely with them, not only to help make sure that that form is easy to fill out for child care providers, but also just to help answer those questions on how to do it, how to support the child care facility to collect that information and process it. We've talked about environmental health several times, about sanitation and working with those environmental health specialists. Early intervention, really important that we are, when CCHCs are working with a child care program, if there's a child that the staff are concerned about, that we can maybe have early identification and connect them for screening and services as early as possible. And then oral health is another partner that we work closely with, because we know that, oral health, just like our mental health, is part of our overall health. And so that critical promotion of oral health in the child care with children and families. You can go to the next slide. And then I wanted to talk about the North Carolina Child Care Health Consultant Association, and that is a professional membership organization. So you do have to be a member to participate. It is overseen by an executive committee that has elected officers, subcommittees, and subcommittee representatives, and also regional representatives, as well as representation from the Resource Center staff. And the association provides lots of opportunities for networking through an annual conference. And that is actually open to members and non-members. We have quarterly meetings that are held for CCHC members, association members, and it's a good time for child care health consultants to come together and share issues and share resources and ideas, successes and challenges that are going on in their counties. And then we also have subcommittees that work on various things, such as our conference planning committee. We have a review committee that helps provide guidance on all of our documents from folks that are out in the field. We have, I'll probably miss one. We have a website committee of one right now. I'll give Theresa a shout out because she deserves it. And then we also have a certification committee. And then we have, the final one is the public awareness and outreach and communications committee. And those folks are really took the lead on working with a representative to get our week of the CCHC. And I do want to just highlight, because I don't think it was mentioned, that we're celebrating 25 years of CCHCs in North Carolina. And the first CCHC was trained in 2006. So we're we feel very
1996, Amy.
Huh?
1996.
Oh, sorry. 2006. I didn't do. Thank you for correcting me.
No worries.
So we are very proud of that, and we feel like that like we said, we have a long history of child care health consultation in North Carolina. And you can go to the next slide. I did want to add one more thing. I think I said that folks can attend the conference, but you can also have a membership association if they are for CCHCs, but they're also for associate members. If someone is supporting a CCHC, or is a professional or a leader in your organization that works with CCHCs, and you're interested in joining, that is also an option. And then after a CCHC has finished the course and completed the qualification and then worked for 1 year, he or she can apply to receive a certification and technical assistant endorsement. And this is, this is granted by the North Carolina Child Care Health Consultant Association, as well as the North Carolina Institute for Child Development Professionals. And so this is also equivalent to the level 11 TA endorsement that the Institute issues. In order for a CCHC to renew, they have to make sure that they're maintaining, continuing education, and that renewal process can happen every 5 years. So that's something exciting and fairly we're actually about to renew our first certified CCHCs this year. So that's been in place for 5 years. And before I turn it back over to close, I just wanted to acknowledge that I do think that we probably have some folks join us who are from other states. And I know that we've really talked about North Carolina throughout this time, but I wonder if there's anyone from another state who has child care health consultation in their state, because there are, that is a national thing, that there are several states who have CCHCs. Not every state does, but I also wanted to just give an opportunity if anyone had any kind of general questions about child care health consultation that maybe we have not covered, or would want to share anything from their state. And Theresa has her hand up.
Oh, well, yeah, do that. Certainly put that in the chat. But there has been a question. And I'm gonna
Okay.
let Jackie.
Well, let
you
me
wanna-
just say that this is our this is all of our contact information, and this is our website, so healthychildcare.unc.edu. And so I'm just telling you that now, so you'll be able to get all of this information by coming to our website. So I can stop sharing, and we can see you, and you can see us, and we can do some questions for the last 12 minutes. I do see that there are some questions coming in, and because I was sharing my screen, I have not been monitoring them. So I don't know if Theresa, you've been looking at them. I did see one here come through that asking about grants for CCHC services. And the way I want to answer that is by kind of redirecting to talk a little bit about the expansion that's going on right now. Amy mentioned it, but there aren't grants per se for getting a CCHC into a county. But with expansion, every partnership in North Carolina that doesn't currently support a CCHC has had the opportunity to support a CCHC with funding from DCDEE, and it's a work in progress. We know that that's not that it didn't all happen at once, but it's hopefully going to happen in the next year, and that is an opportunity that is the state. DCD in particular has made available based on the fact that COVID has brought up the need for this work. I mean, the fact that our 0 to 5 folks are being served in childcare with no access to health supports is just been really highlighted by the pandemic. So there is an opportunity for every county to have a CCHC, and there is a link on our website under CCHCs about the expansion process. Just a little bit of information, and you're welcome to ask us more information at any point. But you can read about that there, and then and hopefully a CCHC will be coming to your community soon, I hope. And if you want to know about what's coming, you're welcome to get in touch with the Resource Center at any time. So please do. So what other questions? What other questions do we have?
Am I mute right now?
Nope, you're not on mute.
There was a question from Ohio about whether or not CCHCs are available in every state, and the answer to that is no. That not every state in the United States has childcare health consultants. I'm not entirely sure about Ohio, but I'm trying to find. I know there's a list someplace about which states have them, so I'm trying to pull that up.
I'm looking through the questions, but I'm also happy to take any questions. If you want to unmute, you're welcome to do that as well.
And I think that we've actually answered them up to this point, from what I can tell.
Okay. Well, if you have any other questions, please continue to answer them. You're welcome to. We are here for you for the next 9 minutes.
I know Lisa Schiffler is here, and I know Lisa's been doing a lot of work as a CCHC in underserved counties for CCHCs in North Carolina. That I know, Lisa, did you have anything you wanted to share?
Good morning, guys. I've been listening to this presentation, and I know this is a lot of information, but I have been in the childcare world for 30 years, more than 30 years. I've been a health consultant since 2009. I've been a nurse all that time that I was in childcare. And I just wanted to kind of let you know the impact that child care health consultation has on children and families. And a specific story comes to my mind where I was the nurse and the health consultant in a large child care program that had more than one site. And I was working late one day, and they closed at 6. And when I went out and was locking the door, a man was walking up the sidewalk. And my initial thought was, why are people coming here at closing time? And it was a long day, and I did not let my professionalism down. And I offered assistance, and he was alone. He did not have a child with him. And he started telling me a story about his child, who's 5 years old, who has Down syndrome. And the child had been enrolled in the same program since he was born. And at 5 years old, he was transitioning to the school age program of that same facility. And they were approached without warning and asked to find a new child care provider. In other words, they were kicking him out. He was not verbal, but he was high functioning in many ways. And here's this family who is now being asked to find new child care. And after I, interviewed him and talked to him, it was because there had been a staff change at the facility, and the new provider did not feel like they could provide safe child care to this child who had been enrolled in this program for 5 years. And so we took him on, and the family told us many, many times we saved their life, that the mom was able to continue work. As the health consultant, I was able to educate staff on ways to provide care and to communicate and to, meet this child's needs and to meet him where he was at that time. So if you have an opportunity to have child care health consultation in your area, it is life-changing and life-altering for lots of families. And all this information you got today is how that works. But the impact on the ground is major, and I can't say enough about it. So thank you.
Lisa has a million stories, a million, and every one of them is like more shocking than the next. And I know that it's because, I think anyone that works in childcare probably has some pretty surprising stories, but just the fact that, being a nurse in a childcare facility, it's just, I feel like every time I hear another story, it's another reason why it's just amazing that not having a health professional